Culver's could have only started in Wisconsin. Just ask our team member Marcus.
Let's just say you can take the restaurants out of America's Dairyland, but you can't take America's Dairyland out of the restaurants. Like the real Wisconsin cheese on our juicy butter burgers, the farm fresh dairy in our fresh frozen custard, even our crispy golden Wisconsin cheese curds. It may sound cheesy, but we love where we come from at Culver's.
Almost as much as we love sharing it with our guests. Welcome to Delicious.
Ladies, we're meeting you where you're at. This is the Dare to Ask podcast. Episode 4 in Season 2. One joint at a time.
9 is a bear is mauling you, you know. Some people's 9 is your 2.
I'm Corey Jensen, your host for this Dare to Ask podcast. I'm a mom to a big family and have delivered 5 babies. And like many women, I try to stay informed about my wellness as well as the health of my kids. We've created a space to have open conversation about what's going on with the woman's body without feeling intimidated in a clinical setting. A place to talk like girlfriends do. A space that dares to ask.
We're here to make a connection, be authentic, and really get to know your provider. Yes, know the person behind the stethoscope. Dare to Ask will be where you hear the questions that we are all curious to know, but just need a space to do it. You've landed on the Dare to Ask podcast, show hosted by Corey Jensen and sponsored by Essentia Health.
Shifted more into the knee realm. I really enjoy knees.
You don't hear that every day.
Yes.
Not everybody's like, love that knee.
Yes.
Well, she's amazing. She is one of the only orthopedic surgeons in our region who is a woman. Since she is a returning guest from Season 1, it means that we get to kind of dive in a little bit deeper to orthopedics. We cover the pain scale. Dr. Roxanne Keene and I think it needs a complete revamping to include bear mauling. You'll understand once we get to it, but it should be on the list. And how the team approach actually makes a whole lot of sense in orthopedics and what's exciting for the future. We get Dr. Keene's expert opinion on the advancements in products and techniques and what it's doing to change lives. It's going to be fun. Let's get to it. What I'm excited about is that, Roxanne, you're one of the few return guests from Season 1 of the Dare to Ask podcast here for Season 2.
That's awesome. Thank you for having me. Yeah.
I love it. Now, it was really fun last year getting to know you a little bit, know about your life, know about kind of your past and all the different places you've lived and about your girls and your hubby and your love of Peloton. Is that still a thing?
Oh, I'm still a big fan. Yep, definitely. Yep.
Good. Okay, so what's new? What's happened in the last year for you on a personal level? Whatever you want to share.
Yeah, it's been an interesting year, a long year, but I feel like just things have settled down a bit more in the fact of just getting back to life.
Yeah.
But busier in the fact that kids are getting older, more activities, work, kind of fitting it all in. So,
which your girls are in both physical and the arts. Am I right?
Yeah, out extracurriculars, mainly sports, but they are in band and choir in school as well.
Yes.
So, yeah.
A little bit of everything. And remind me, how old are they now, or what grades are we looking at?
Yep, so I have a 12 and a 13-year-old, so 7th and 8th grade. So I have one going to high school next year, which is really strange for me. Yeah. But yeah, and they're both in travel. The one's in travel volleyball right now. They're both in travel basketball. So we kind of live our life by a Google Calendar to tell us where to go.
Yeah.
So, yeah.
And then Google Maps once you're on the road.
Exactly.
Ready to
Yes.
go.
Yeah.
Where are we off to now?
Yep.
And the hubs, how's he doing?
He's good. Goes with what, we split up the tasks. And yes,
where are the women going?
Yeah. And he enjoys it. They're in sports, so he's, working with them a lot on that too.
Yeah.
So, yep.
Well, and because of your clear history, with sports medicine, you in orthopedics, you're probably dealing with how much percentage of sports-related either injuries or concerns with ortho?
There's a fair amount. We're lucky at Essentia we have a sports medicine specialist, so he tends to shift and get more of those cases. But, as far as non-operative sports injuries, we see a lot of that in clinic as well.
You cover the gamut when it comes to orthopedics. Have you refined that, or are you still from pediatrics all the way to geriatrics?
It's been an interesting transition because that's why I did general orthopedics. I love general orthopedics.
Yeah.
I loved, the different areas. Being with the multi-specialty group now, we've tended to kind of try to find our own little niches.
Sure.
And so I still do a fair amount of general orthopedics just because of the volume that we have with limited surgeons. But I've kind of shifted more into the knee realm. I really enjoy knees.
You don't hear that every day.
Yes.
Not everybody's like, love that knee.
Yes.
As I recall, part of your practice of medicine is the being able to fix something, kind of fine-tuned in that knee area. I fear boredom. So do you always find this evolution that excites you about the future?
I think the evolution is coming just in the product itself and the techniques to get you to that final outcome. Back when I first started, total knees would stay in the hospital 5 to 7 days, and we'd slowly get them up and get them moving. It's moved to an outpatient procedure now. So I have patients that go home the same day. Even though the process is the same, we've had to come up with different ways to control pain. How do we get it moving quickly? Things like that. So that, and then the technology. We're doing more computer assisted, hoping to move to robot assisted at some point in the future as well.
Very exciting.
Yeah.
What lights your fire right now?
I like the volume of patients. So I have a great PA who's been with me a long time. And so we work really well together. So part of it is probably my inner competition too, but how quickly, how efficiently, and in a quality way can we do our procedures, get things turned over, get to the next patient, because the less time they're in the operating room, the better outcomes there are. Making things more efficient, I guess, is kind of where I'm at right now.
That's what everybody wants. Nobody wants to, quote, heal forever, and nobody wants to be in pain forever either. How do you get people out of pain? It is in the mind of the beholder. It's in the body of the beholder. This has always been something I've been curious to ask. How are you able to interpret someone else's pain?
Yeah, and that's been a tough subject because we're in an opioid crisis now, and so we've had to monitor or change a lot of our process. And I can remember when we started using almost pain was a fifth vital sign. People are in pain, we need to control their pain. And medicine as a whole kind of did a disservice by attacking that with just narcotic medicine. So as we've evolved, each person is different, right?
Yeah.
So I love the pain scale, a 9 is a bear is mauling you, where some people's 9 is your 2.
And this is where I am so fascinated by how you interpret pain.
Yeah, my pain's a 10, but they'll sit in bed and talk to me. Where my thought is, if I'm in a 10, I'm laying on the floor somewhere. Post-op patients is always, our goal is to make your pain tolerable. So maybe your tolerable is a 2, but we want to make it tolerable because it's all in the perception. I'm not a big fan of the number scale. I think that we tend to base everything around that, but it's too variable. It's a great tool, though, if you use it as, what's your pain today? It's a 2. Oh, yesterday you said it was a 5, so it's better. So if you can track each individual's pain scale, I think it's better.
I think so too. Yeah. I agree. I've always thought of myself as I think I have a pretty good pain toleration. And then once you become a mom, I really realized, I actually have a high tolerance of pain.
Yes.
I had no idea my body's ability to handle things. Delivering 5 kids, naturally understand what a height of pain is, and then having back issues and having a back go out. And I still remember I wasn't putting myself in this 8-9 range. I was thinking, I think this will probably be a 7 or an 8, but I was physically passing out from the pain.
Yep.
When I came to, I'm like, I'm so sorry, I'm tired. And my husband had to look at me and said, you just passed out. And I had no idea I was already at that level.
Yes.
So bear mauling me level, and I'm still putting it way further down because I just think, isn't 10 death?
Yes,
doesn't it mean I cannot function whatsoever? So I can only imagine, as somebody in your position, trying to interpret what somebody's pain is.
Yeah, pure number, I think, is really hard to look at. So,
when do you want to see patients when there is a problem? At what point? If I see something starting to deteriorate, maybe it's a minor or even mid-level injury, but I'm nervous about what it could become, when do you want to see people?
It goes back to having a good team of care, Do I need to see everybody right away? Maybe not, but I think patients who have questions or are starting to have issues, should talk to maybe the nurse triages and says, you know what, this isn't a typical, or this is typical for you. And then if she has questions, maybe you have a mid-level or an advanced practice person who says, have you come in, and if it needs to be evaluated further. So I think if you have a good team, it makes people still get the answers they want, give you options. Yeah,
whether it's we're still dealing with just simply pain management, maybe it's some physical therapy that could be happening that might help elongate the need for further intervention. It's like team approach is really helpful here.
Yes. We have the electronic medical record now, which gives patients access to us almost 24/7, which there's not a lot of professions where you get access to your person 24/7. But it is an option to allow patients to just get a quick answer back on, the provider's time too. So I think that's another way that can, without having to interrupt either the patient's day or the physician's day.
Career mom, working full time, but also have a million things on my plate, and I'll wake up at 2 a.m. and it'll be on my mind, and I'll think, I'll never remember this in the business day in which I could call and ask my doctor a question or put a question into the nurse. So instead, I'll pull up the my chart, I'll fire off a question. I have zero expectation that I'm going to get a response at 2:30 a.m. But at least it's like, okay, that's off my plate. My mental load is gone, and I know that I'll get a response within 24, 48 hours. I know that I'm going to hear back. I love it for that. And we've seen this now for 2 years, how telemedicine has so certainly evolved. I just had a telemedicine appointment with my GP yesterday, and I had thought about it. I'm like, I need to do this, need to, check in on meds and think on these other couple little things. I'll put an appointment request in. I was in within 3 hours with my doctor. It was wonderful. I wasn't expecting that, but the timeliness can be so great. It's so convenient. You can do it from your home. And also, because of the medical strain that we have right now, nurse shortages, easier maybe this is as an option.
I think it's a great option in the right situation. So it's hard to do a new patient eval for orthopedics, and I'm only speaking for orthopedics because there are a lot of areas. But follow-up visits, just check-in visits, I think we need to do a better job, I think, as a system to make that a little bit easier, because you get the patient who's checked in, their camera's not, I think.
Oh, for sure.
Which is still, it's evolving, but, and people are getting much better at it. But I think that's one of the areas where we could do better as a health system.
For sure. And I can see, especially, that's an unfair comparison really with a general practitioner who does it probably, 5 to 6 times a day, maybe more or maybe less, depending on the day. Or, your orthopedic surgeon like you are, where I can imagine your telemedicine appointments aren't near that vast quantity.
Yeah.
And you really do, especially with that first patient intake. You need the hands-on.
Yeah.
You just do. And that makes way more sense.
Yeah.
What are you looking ahead in orthopedics that you're foreseeing right here in our Fargo-Moorhead area, or even North Dakota? Because as we spoke about last year, and I know the numbers have not increased all that much, you are one of the only women orthopedic surgeons in our region and in our state. Has things changed at all for that in the last year?
I don't think so. As far as I know, there's still 2 of us that are practicing. I think the residency program, that last I heard, maybe has 2 females as well. Maybe they've gotten more. So I think that's a good start for the state. Hopeful, just being involved in national groups, that this continues to increase, but we haven't seen a big difference from last year.
And I imagine that being the case for a number of other reasons, because still we have to put on pandemic hat brain here. With shortages everywhere, almost every field. Can't imagine having to be that young person who's making choices right now about their future. It's so hard to determine what we're doing in our own careers as, somebody who's established.
Right. And I think the pandemic has changed a lot of just different positions in healthcare. People found that, either they can work from home or they're okay not working as many hours. There's a lot of information now that orthopedic surgeons will be at a shortage as early as 2025. I'm curious how we fix this as a society.
Where are you in your career in terms of, do you have in your mind I'm going to work until this point in my life. Because obviously your kids are still in school. They're young. You're healthy. You're young. As women, as we're evolving, instead of a standard, let's say I'm going to retire at 65 because that's what I'm told to do. We're redefining new rules and limits for ourselves. So I'm curious on a personal level.
We ask our financial advisor, can we retire now? And he says, well, sure, you can, but you're going to have a very different lifestyle.
Yep.
So
you're like, okay.
Yeah, so I'll keep doing that. My girls have 5 years left of school, which is crazy, and then hopefully college afterwards. So I anticipate in that 10 to 15 year range, we want to travel, obviously.
Don't mistake that question for me wanting you to get out, because I don't. I think we need you, especially now. If people are listening to this podcast, say for the first time, and they've never seen an orthopedic surgeon or anyone in your field, but they are questioning, maybe I need to. When should I go? When do I actually take it seriously to go get surgery?
I think a lot of people are scared to go in if they do have those things because they think, well, I don't want surgery.
Yep.
And I think people have to realize that, if you have an injury or a condition that's really affecting your lifestyle, if you're not doing the things you want to do and your vacations are because your hip or your knee or your shoulder hurts or you don't play with your kids or grandkids as much, there's a lot of non-operative options that are easy, maybe simple, and get you back to doing those things. It doesn't mean surgery either. Now, sure, we have a lot of surgeries that can help too, but I think just have it evaluated, get your options, know if you're causing more harm to yourself, or maybe it's just an issue that if you continue to deal with it, you'll be fine too. But I think just getting into...
We got to start somewhere, right?
Yeah, right, yep.
My mom has been someone who has had a lot of issues and has had a number of surgeries, and I have not had any. And where am I in that? What should I be paying attention to? My DNA? What should I be concerned about?
Well, there is a genetic component to a lot of things. But again, if it's something that you're dealing with and can be fine, I don't think that needs to be evaluated necessarily.
Right.
But again, if it's limiting you or keeping you from doing I'm getting older and I know that there's aches and pains and I don't feel the need to go to the doctor for all of them. But if it was something that every day I was waking up or I didn't want to get out of bed because my back was so sore, maybe we have a lot of good options now.
Right.
So,
right.
Yeah.
My mom has had both ankles replaced, both hips replaced, and she's doing great. But what I saw growing up was her severe limitation on what she was able to do because of those things, and her always putting off the next surgery. And because of, my parents having a farm and ranch, and then my mom also working full time, it was like, well, I don't have 6 weeks or 8 weeks to be down and, out of commission. But you kind of are already. You're limiting what you can do anyway because of the pain that you're constantly in. Well, and once she finally wrapped up, some toe issues too. So in a fail swoop, it was like do an ankle, do bunions, fuse toes, all of this footwork at once. Now that she's done with all this stuff, she is like a new and completely different person, where the rest of her health started to fall into place too. Losing weight, she's so much more active. And she has said on so many occasions now, why did I wait so long?
Yeah.
So much life to live. Why did I wait so long?
Well, and I think a lot of times, we used to tell people, just even, for example, knee replacement, we used to tell people, well, put it off as long as you can, because the implant itself, has a finite length. And we used to quote people 10 to 15 years, and now it's improved markedly. What do? Do you just sit around and wait till what's old? Is old 50? Is old 70? So a lot of studies have started showing if we do these people when they're younger, before they lose muscle mass, get all those other medical conditions, we get them back to life and they actually do better. Sure, they may need a repeat surgery in the future, but they're, like your mom found, is just they're back to doing things.
Back to doing things, feeling great, not missing out. It was such an improvement on the rest of her health. Just physically able to do things meant, the rest of it was starting to fall into place.
Well, and chronic pain is wearing on a person. It affects your sleep, it affects your mood, so if you can address some of those things, it does improve your overall life too.
I so agree. pain chronically, it starts to change you as a personality and as a person too.
Yes.
You're realizing like your fuse is so much shorter for those that you love in your life usually, or those in your close sphere. And that's really sad when you think about it. Like, I'm in so much pain. I'm so sorry. I'm taking it out on you guys.
Right.
But
Yep.
so often people get caught into that because, we miss that mindfulness because pain does that to people.
Yep.
So I like that you talked and spoke about the opioid epidemic, and it's not just medicine that can get us into some pain management that really can help.
Right. Yeah. That's key. There are people who do need the medicines, but you want to make sure it's not everything else has been tried first as well.
Yeah. When it comes to all of your replacements, when you say the implant, what is the main component? Are we still at a metal component, or has that changed?
For the most part, it's a metal component. It's a blend of metals which are very inert, cobalt chrome being the main one. And then there's a plastic or polyethylene piece that's in there as well. And so the advances as far as length of the replacement or lifespan of the replacement has really been more due to the different properties of that plastic piece and how it's made.
Yes.
And so that's allowed us to give a longer duration for lifespan.
Which isn't that so exciting?
Yes.
I mean, that was one of the things that I always grew up hearing was my mom's like, well, I got to put this off until this.
Yes.
Because, then in 10 years, I'm going to be back getting another one. And when it comes to ankles especially, that was one where it was always such a short lifespan, which I'm sure you're well versed in. Yeah. And it took her a while before she found the right provider, the right surgeon, the right implant before she felt like she was a different person in terms of hope for the future.
So you have the implants, you have that we're getting them active quicker, and then you have the technology, the robots, things like that, which are going to help guide placement so we get hopefully better alignment, things like that. So everything's kind of coming together to make the optimal condition for that implant.
Do you feel like people, they come in a little ill-prepared in terms of what their expectation for what they're able to do afterward? Or do you think more people now with the internet and just the age that we're in, and it's always like, at this point, somebody who's had an even knee replacement. Almost everybody does.
Yeah.
And you start asking those questions and what are the changes? And I knew somebody recently who I think completely misunderstood and thought that they would be doing all these things within a week's time. And it felt like everybody around them were like, are you on the same planet we're all on?
And it is hard because, I say about 4 to 6 weeks of physical therapy and people think, but for 6 weeks, I'm back to where I was. It's up to a year for a knee replacement. It's all the soft tissue shifts, things like that. We try to do a joint class prior to surgery and kind of what to expect before, during, after. Because I've really found that since I started doing a joint class before, they know what to expect.
So what is a joint class?
A PA nurse and I would have this class for the upcoming joints. And we would go through a PowerPoint. Here's what, the process is. Here's what we'd have a therapist come in. They'd go through the exercises, what to do. People who do exercises prior to their joint replacement do much better. And so we just found that we tell people you're going to have pain. We tell them what to expect in the hospital. And they just came in much more calm and collected than the person who watched a YouTube video the night before. And she's a nervous wreck because she's like, oh my God, I didn't know you used a saw. And I was like, I had to talk her down prior, So we incorporated that here, and we don't have the personal class because right after I came COVID, but we have now a nurse that sends a video to them and kind of goes over everything with them. So it's made a big difference in what people expect afterwards.
I can see why. Like an actual expectation that's real life. It's not just, well, I know so-and-so, my coworker whose brother went through this and they did this XYZ and that'll be how it'll be for you. And
right.
Wait a second. It's okay to be asking your doctors and your surgeon, okay, is this real life? Is this what I'll be experiencing?
And it's really hard to go through that in a 20-minute office visit,
True.
So it does give a little more information for them.
It's kind of like Lamaze class. It's the joint class.
Yes.
Especially for first-time replacements. You might need to know about this. Any breathing techniques?
Yeah, we should incorporate that.
Do I get a coach?
Yeah, we do. We ask them all to have a coach that watches it with them. Yeah.
Oh, I like that.
Because everybody hears different things, So we always ask that they have a coach or a significant other that can attend as well.
I like that a lot.
Yeah.
You drop always so much great information, and you do it in such a applicable way. Thank you so much, Dr. Keene, for coming in today, for joining me again. Hopefully we've given some people some new information. Best of luck to your family as you guys are doing all your activities and making your way into high school.
Yeah,
Best of luck, Mama.
All right. Thank you very much.
Thank you.
All right.
I always get these mad vibes of female empowerment whenever I get the opportunity to talk to Dr. Keene. On the next episode of the Dare to Ask podcast, we're going to get into genetic counseling. This is a growing area, and Essentia is bringing the best. I'm going to be introducing you to just a ball of energy, and she really is fun, and you're going to have a great time getting to know her. Alexa Sandman joins me next on the Dare to Ask podcast.
The information contained in this podcast is not intended to be a substitute for personalized professional medical advice, diagnosis, or treatment. The information is general in nature. If you have questions or concerns, please contact your provider.
A lot goes into taking care of your property. You need equipment with more reliability, durability, and versatility built in. Like #1 selling Kubota BX and L Series compact tractors, Z-Series mowers that deliver a quality cut, and Sidekick utility vehicles where durability meets speed. Visit your local Kubota dealer for a demo today.
Value Implement. On the web at valueimplement.com.